So I'm just going to conclude by just saying a couple of things. One is we've seen what are the challenges that we see in patients with these problems. One is pain, spasticity, contracture, and also loss of function. And what does the patient expect? The patient expects a functional independence, self-care, social integration and communication, and mobility both within the house and outside. So if you just look at a patient who uses his upper limbs, he's doing his shopping, driving, cleaning, cooking, and if imagine he has a contracture and pain. So this is going to be severely affecting his quality of life. So that's what we've seen today: medical management, therapy, various procedures, and surgery. So we've looked at all the medical management with pain medication, and then we've looked at oral baclofen. And if all this fails, then we have other surgical therapies to deal with the pain, spasticity, and also restorative surgeries in terms of tendon transfers, nerve transfers. So the intervention pain management, we have for the pain, we have various injections we can try, from facet injections, RF ablations, epidural steroid injections, and various other things with image guided, CT guided, or ultrasound guided. And then we looked at dress lesionings for neuropathic pain. We have then also seen the use of neuromonitoring in this for safety. And these are some of the patients. And I find that the dress lesioning is in India is one of a cost-effective option. And in patients with severe spinal cord injury, I have seen dramatic improvements. And I routinely do this for both brachial plexus injury and spinal cord injury, especially at the conus level, they do extremely well. And the dress lesioning is a very simple procedure which most neurosurgeons can do, where you can do a rhizotomy at multiple levels from C5 all the way up to T1. And also you can choose the level where it is, and the complications are fairly very minimal. You have good neurophysiology. With spasticity, we've discussed some options, but the other options available are, Botox injections, intrathecal pumps, neuroablative procedures, which are selective neurotomies, mylotomy, selective dorsal rhizotomy, dress lesionings, and also neuromodulation, which we saw in the last speaker with the epidural stimulators, spinal cord stimulators, DBS, and other various other cerebellar targets, which are all coming up. So it's just a couple of cases, a 73-year-old who can't use the hand, and a simple Botox injections, they're able to use the hand to use a walking stick. Baclofen pump, we had an excellent talk by Dr. Vishwanathan, fairly very straightforward. Selective dorsal rhizotomy, again, we saw the use in both cerebral palsy in children as well as in adults with selective in a single monolimb or with bilateral. So the limitations of all these procedures that we have explained is you need to choose the right patient, because they're invasive and they're irreversible. Once you do the selective dorsal rhizotomy, it's irreversible. You can develop a lot of side effects like paresthesia and various other things and variable effectiveness. And then something that we've not discussed in this meeting is about the various other procedures which are there, which is like tendon transfers, nerve transfers. And here's just an example: a patient who cannot use his hand. And he had an C7 T1 for quadriparesis. And just a simple tendon transfer surgery and 3 to 6 months of intensive occupational therapy and hand therapy, you can see that he is able to, and these are some of the pictures from immediate post-op, and then he's able to pick it up, and then they are able to write. So this is a huge disability which can be easily corrected with these procedures. And there's lots of nerve transfers which are coming up, which is very important in the care. Tendon transfers are well established. Can either be also supplemented with functional electrical stimulation. There are implantable devices which you can connect with functional electrical stimulation. And these devices are available both in India and in abroad, and they are very useful. And on the first day, we saw a lot of discussion about robotic, virtual reality, technology, gamification, brain-computer interface. All these help with a combination of procedures. So you can do an selective dorsal rhizotomy, you can do a dress lesioning, you can do a tendon transfer and supplement them with robotic therapy. And the neuromodulation, which we have discussed, the brain interface, the epidural stimulator, and management. So it's